Today, kidney diseases have emerged as one of the fastest growing causes of death globally. And the unfortunate reality is that 90% of people suffering from kidney issues are completely unaware of their condition. In this video, I will be sharing 6 key signs that could help you recognize if something might be going wrong with your kidneys. Toward the end of the video, we'll also cover a few simple but effective tips on how you can take better care of your kidneys. So, without further delay, let's dive right in. Hello friends, welcome to Healthy Dapa Channel. Kidneys, which are located on either side of our lower back, perform the vital function of filtering waste products from our blood, which are then eliminated through urine. This is common knowledge. But what many people don't know is that our kidneys are also responsible for maintaining normal blood pressure levels. Moreover, kidneys play a crucial role in producing blood and ensuring our hemoglobin levels remain balanced. The vitamin D that we get from sunlight or food is essentially useless until it is activated by the kidneys. Additionally, kidneys help in removing excess uric acid and maintain a healthy balance of essential minerals like calcium, sodium, and phosphorus in the body. When such a vital organ as the kidneys isn't functioning properly, all of these critical functions are compromised. The problem, however, is that during the early stages of kidney malfunction, very few symptoms are noticeable. By the time it is diagnosed that the kidneys aren't functioning well, 70 to 80% of the damage has already occurred. This is one reason why, in just 10 years, the number of kidney failure cases in India has increased by 50%. But there's no need to panic. By staying a bit more proactive, you can detect early warning signs that indicate something may be wrong with your kidneys. This video is aimed at helping you recognize those signs. Among the most reliable indicators that your kidneys aren't working properly are changes in your urine. On average, a person urinates 6 to 10 times a day. But if you notice that the frequency of urination has either significantly decreased or increased, especially if you find yourself waking up multiple times at night to urinate, this could be a red flag. Some individuals might feel the urge to urinate, but when they reach the restroom, very little urine is passed. This unsatisfactory urination can be a sign of a kidney stone that has moved into the ureter. Additionally, if you notice a lot of foam in your urine or a foul odor when urinating, this could indicate that your kidneys' filters aren't functioning properly, causing protein to leak into your urine. It's normal for some bubbles to form when we urinate, but they usually disappear quickly. However, if your kidneys are not working properly, the foam resembles soap suds and lingers for a longer period. This protein leakage in the urine is an early warning sign of kidney disease and should not be ignored. Creatinine levels tend to rise much later in kidney disease, but protein begins to leak into the urine much earlier. Essentially, protein is supposed to remain in the bloodstream. But when the filters of the kidneys are damaged and the holes become larger, protein escapes through the urine. Much like straining tea with a broken strainer where unwanted particles slip through. If you experience a burning sensation while urinating or notice that your urine doesn't flow smoothly, this could be a sign of a kidney infection. Since the kidneys produce urine, any malfunction in the kidneys will naturally lead to noticeable changes in your urine. Another symptom to watch out for is swelling. If you regularly observe swelling in your ankles or puffiness under your eyes, especially in the morning, it's important not to ignore it. One of the primary functions of the kidneys is to eliminate excess fluids and maintain the balance of minerals like sodium in the body. When the kidneys aren't functioning well, they can't filter out the excess sodium in the blood. We know that increased sodium in the bloodstream causes fluid retention, and in the case of kidney damage, this fluid accumulates, particularly in the lower extremities due to gravity, leading to swollen ankles. Low levels of a protein called albumin can also contribute to this swelling, known as pitted edema, where pressing the swollen area creates a noticeable dent. This type of swelling is also associated with liver disease, as the kidneys and liver work together closely. In the morning, the retained fluid often causes puffiness around the eyes. If you continuously notice swelling in these two areas, it could be a sign that your kidneys are not functioning properly. Next up is back pain. Since the kidneys are located on either side of your lower back, if you often experience persistent pain in that area without a clear cause, it could be a warning sign of a kidney issue. However, before we jump to conclusions, it's important to recognize that back pain is a common condition and can occur for various reasons. So, how can we tell if the back pain is related to a kidney problem or something else, like poor posture? First, typical back pain caused by lifting heavy objects or incorrect posture is usually constant and doesn't fluctuate much. In contrast, back pain due to kidney issues tends to come and go. It appears suddenly, disappears, and then returns. Urologists often refer to this as intermittent pain. The second key difference is that kidney-related back pain is not influenced by external factors like movement or posture changes. Whereas regular back pain can get better or worse depending on how you sit, stand, or move. Third, kidney pain may begin in the lower back but can radiate to the front, extending to the stomach and down into the pelvic region, while normal back pain typically stays localized. Fourth, kidney-related back pain is often accompanied by other symptoms like fever, nausea, vomiting, chills, or difficulty with urination, none of which usually occur with ordinary back pain. Sometimes, the pain is only felt on one side of the lower back, which could suggest that only one kidney is functioning improperly. It's crucial to pay attention to these signs and assess the kind of pain you're experiencing so you can draw an appropriate conclusion. Don't just rely on over-the-counter painkillers to mask the pain. In fact, studies have shown that people who frequently use painkillers have a higher risk of developing kidney disease. Moving on to the next symptom, tiredness. Our blood contains red blood cells, which carry oxygen to various organs in the body to produce energy. This is well known. But how do these red blood cells relate to kidney health? To produce red blood cells, the body needs a hormone called erythropoietin, EPO, which is produced by the kidneys. When the kidneys aren't functioning correctly, they don't produce enough of this hormone, leading to a reduction in red blood cell production. As a result, fewer red blood cells are available to carry oxygen to the organs, leading to fatigue and a lack of energy. This is why persistent fatigue, even after getting a full night's rest, is considered an early sign of kidney problems. Urologists point out that fatigue caused by kidney issues can be so severe that people struggle to complete everyday tasks, such as taking a bath or walking just a few steps. Shortness of breath may also occur when climbing stairs. However, it's important to remember that tiredness can have many causes, so it's always a good idea to get a blood test to rule out other possibilities. If the test shows a low red blood cell count or low hemoglobin levels, it could indicate a kidney problem. But there's no need to panic. I've shared a simple juice recipe that only requires 3 ingredients: beetroot, carrot, and amla, Indian gooseberry. Drinking this juice for 10 to 15 days can help increase your red blood cell count significantly. One of the primary functions of the kidneys is to purify the blood. But when they can't perform this function properly, another symptom can appear: itching. If you experience frequent itching or notice patches forming on your skin, it could be due to toxins in the blood that the kidneys aren't able to filter out effectively. In some cases, the itching might be confined to just one part of the body, while in others, it may spread. The color of the skin may also change, turning yellow or brownish, which indicates an accumulation of toxins. This is why, in 10% of cases, kidney issues are first diagnosed by a dermatologist, who may recommend a kidney function test. Since the kidneys are responsible for regulating mineral levels in the body, people with kidney problems might also experience dry skin, regardless of the season. Using lotions and creams won't resolve the issue because the problem is internal. If you've been dealing with persistent skin problems and have tried various treatments without success, it's important not to ignore the possibility that it could be linked to your kidneys. Finally, let's talk about high blood pressure and diabetes. While these aren't exactly symptoms of kidney disease, there's one thing we know for certain: if you have high blood pressure or your blood sugar levels are consistently elevated, you're at a much higher risk of developing kidney disease. Both conditions can significantly damage the kidneys over time, so it's essential to manage them carefully to prevent further complications. This is because in approximately 40% of kidney failure cases, high blood pressure is identified as the primary cause. Moreover, 1 out of every 3 people with diabetes will experience kidney damage. The reason for this is that when blood sugar levels are consistently high, the blood thickens, causing tiny blood vessels in the kidneys to rupture. Similarly, high blood pressure damages these small kidney vessels as well. In fact, high blood pressure is not only a leading cause of kidney disease, but it can also be a consequence of it. One of the key roles of the kidneys is to regulate blood pressure. So when they fail to function properly, it can lead to high blood pressure. Over the past decade or two, there has been a dramatic rise in cases of diabetes and high blood pressure, which explains why kidney failure has become increasingly common. Experienced doctors recall that 20 years ago, dialysis machines were rarely needed in hospitals. Nowadays, these machines are in high demand, even in smaller hospitals. If you want to keep your kidneys healthy, it's crucial to maintain control over both your blood pressure and blood sugar levels. A few months ago, I shared a video explaining how you can not only manage but even reverse diabetes by eating the right foods. And I highly encourage you to check it out. The kidney's primary function is to filter the blood. But when they fail to do so efficiently, toxins begin to accumulate in various parts of the body. If these toxins build up in the stomach area, it can lead to a loss of appetite or a feeling of nausea. If they accumulate in the brain, you may experience symptoms like difficulty concentrating and trouble sleeping. If they settle in the lungs, it can result in shortness of breath. When these toxins build up beneath the skin, they can cause itching. Unfortunately, these early signs are often dismissed as minor issues. It is only after 70 to 80% of kidney function has already been lost that more serious symptoms begin to emerge. But even at that stage, it's possible to reverse kidney damage if you make the necessary lifestyle adjustments. The first step to protect your kidneys is ensuring that you are drinking enough water. Many doctors agree that one of the major causes of kidney stones and infections is chronic dehydration. How can you tell if you're drinking enough water? Simply check the color of your urine. It should be clear. Drinking warm or hot water can offer even more benefits. In one study, patients with kidney issues who drank a liter of hot water in a short period of 30 minutes saw their creatinine levels decrease by 20% and their urea levels drop by 40%. To make it easier to stay hydrated, consider carrying a thermos with you. Second, it's critically important to avoid taking antibiotics and painkillers unless absolutely necessary. Overusing these medications can harm your kidneys. Gym goers who take steroids also run the risk of damaging their kidneys. So be cautious. If your creatinine levels are increasing, it's important to reduce the amount of protein in your diet. One often overlooked, yet powerful practice is rapid exhalation breathing exercises, such as Kapalbhati. Studies have shown that performing this for just 10 minutes a day can reverse end-stage kidney disease within 6 months. Additionally, remember that the more junk food you consume, the more strain you place on your kidneys. Your kidneys act as a natural detoxification system, and we often take their function for granted. But it's important to note that once your kidneys fail, recovery is incredibly difficult. Dialysis is not only expensive, but it's also a very painful and exhausting process. So, it's vital to be mindful of these 6 warning signs and make the necessary changes to your lifestyle to keep your kidneys healthy. If you notice one or more of these symptoms, it's best to get a kidney function test, KFT, done as soon as possible.